Thank you. Thank you. Really looking forward to this. And I have to say, actually, it's going to be kind of interactive throughout. So I hope you're not going to be holding back till the end for questions. So my name is Penny. I'm the Managing Director of the Q community at the Health Foundation. That's a community of 5,000 people involved in improving health and care across the UK and Ireland.
Hi, and I'm Tarnia. Can you hear me okay? Good. I am Q's Collaborative Change Manager, so I look after a lot of our grant programmes and our membership as well. It's really lovely to be with you this morning.
Great, and I'm assuming a number of you will be aware of the work of the Health Foundation. We've been developing the evidence base and supporting improvement in practice over several decades now. What we're hoping to do with this session is give you an opportunity to think about some of the simple rules that might guide our innovation work. We'll be thinking about the kind of complex challenges that those things will help us to address. We'll be helping you kind of synthesize the kind of evidence around this and make that practical. So we'll be drawing on existing evidence, examples, and most importantly, perhaps, some of the experience in the room. There is an awful lot of evidence and experience that's out there. So, for example, this from the HSN network with a really interesting kind of summary of the different factors that involved. I'm going to, when I circulate the slides, there is a set of references for this, and we're also tweeting the links, so don't feel you need to take notes, because I'm going to run through this relatively quickly. This right, but perhaps slightly less accessible summary, a really seminal piece of work from Trish Greenhalgh, looking at the all-complex set of interdynamics that influence the adoption of innovation. Colleagues at NHS England have pulled together this, perhaps the more accessible summary of some of the key factors that take place. Even though it might be laid out more easily, some of these individual factors are kind of hugely complex things to really get to grips with. There's not very many innovations these days that don't have a kind of digital or technological element, and indeed not many technological introductions that don't have an innovation element. So this framework tries to bring together some of the particular considerations when you're adopting technology, together with what's known more widely about change in health systems. Again, perhaps reflective of the complexity of the issues rather than easily taken to action. So my colleagues at the Health Foundation have distilled that into some of the key factors that influence the adoption of technology. So I feel really privileged to be in a room of people with some really kind of deep expertise around how to develop innovations and then craft strategies that will take that to scale. But I guess we might be perhaps kind of forgiven for being a little bit overwhelmed by the evidence base. I think it's one of the kind of ironies, perhaps the sort of tragedies, that the evidence base around the adoption innovation, in fact, is very difficult to adopt. And that's having a real difference and having a real impact on actually our ability to be able to solve the problems that we face in the health service. So I think Precept has perhaps already been mentioned today. I think it both illustrates the challenge and also the opportunity when we can get this right. So one of many examples of something that is a kind of cheap, well-evidenced intervention that could make a real difference. And yet, for a very long time, actually we saw what the things that would make a difference actually not be adopted by very many places that could benefit. And actually it took the structured support of organisations like the HSN and then a set of people putting together a structured programme that addressed the different factors that influence innovation to actually start to see that adopted at the scale that it deserved to be. But obviously that's the exception. Now, I think that there will be people in the room who are able to dedicate large amounts of kind of time and resource, as they deserve to crafting and developing spread strategies around particular programs of work. But actually there's many innovations that actually we could be starting to do something with to get them kind of further along in their journey. So how might we make better use of some of the things that are known day in, day out around the innovations that we have access to in our work. I thought it might be helpful to use the idea of kind of simple rules. I don't know if you're kind of familiar with this. It's an idea from complexity. So the idea being that you might want to think about the kind of key kind of unspoken or explicit rules that determine how we do things around here. And you can use that to think about actually how do things operate at the moment in order to surface them, interrogate, is that actually helping us in the way that it could be? And we're going to do an exercise in just a moment to think about that at the moment. And you can also use the idea of simple rules to then try and articulate actually how you might want it to be in a way that's kind of simple and easy to keep to mind. So I'm going to move on to that in a minute, but first, Tarnia's going to introduce the first exercise.
Yeah, thanks, Penny. I realised that I seemed to have dressed as an air hostess this morning. I think on some level, knowing I was coming here, I wanted to be fitting and show you all of the exits. That's what I think I want to do. Okay, as Penny said, it feels really important to kind of acknowledge the practical expertise in the room, and we thought it could be nice to get you all talking to one another. And so, you'll see we've got a question on the screen. I'd love if you could turn to someone next to you or a few people and have a conversation just for a couple of minutes about the question. Discuss the simple rules that you feel describe how we're doing innovation now. So not how we could be doing it, how we were doing it, but how we're doing it now. We're going to do that just for a couple of minutes, and then I'll bring you back together. And it would be great if a few people could volunteer to share some of the key points from their conversations as well. So have a conversation. We'll come back together in a minute. Thanks. Thank you. Just already so interesting to be surfacing some reflections and also seeing some similar patterns emerging as well, particularly the last point that was made, and Anna, your point earlier on. It's really great to hear you having conversations so openly, and we're going to have lots more today. I'm going to pass back to Penny, and I'll be back a little bit later on for another interactive activity. Thanks very much.
Thank you. So I guess I'm going to turn now to think about some of the simple rules we might want to have to try and help distill and apply the evidence base. Now, these aren't the only simple rules we can have already in this room. In that last conversation, there are others that we could be adding into mix, other ways of doing that. But I thought I'd have a go at trying to kind of distill 5 things. And I warn you, I have props to try and help these things stick in mind, because this isn't a substitute for the detailed depth of work you might want to do around your innovation strategy. But the idea is to try and come up with some principles that we can kind of bring to mind day in, day out. So the 5 that we've come up with is thinking not just about the shiny ideas, but how they're going to fit, treating adoption as teamwork, thinking about the core of the innovation that you need to scale, and then thinking about how you grow ideas from seed rather than always being able to bring them in fully grown, and then how we kind of connect flexibly as we kind of learn and share. So I'm going to run through those relatively quickly. I'm going to give you a snippet of the relevant evidence and some of the examples. So I guess just to start first with this balance of attention that we give to innovation relative to adoption. So this first principle is about where we focus. I think if we're going to have a culture of innovation, actually what we need is to actually focus less perhaps on the innovation themselves, and perhaps as much on actually how do you make it stick, how do you make it fit. We often kind of act and talk as if you have a kind of case example from one of the nice little publications. They often have a little light bulb that comes along with it to say, look, here's an idea that we could take and fit into our service. And yet, in practice, it's perhaps a little bit more like, well, at least my experience when I'm actually looking to fit a light bulb, which wouldn't be anywhere near that neat. So, I would often be scrambling around, obviously a bit like the NHS. I wouldn't have thought about this in advance, and so I'd be trying to find something that will fit while the lights are flickering or have completely gone out. And then when I actually try and rummage around, it turns out that we end up with something that has a bayonet fitting when you need a screw top, and and ends up being the wrong size. Just to extend the analogy a little bit, the adoption of innovation in the health service it's not like the built environment where you can take something and plug it in. Actually, it's much more akin to going to try thinking you're going to fit a light bulb and finding out that actually means that you have to rewire the entire building, really rethink about all of the funding and the workforce and other implications that need to fit around. So while the light bulb analogy is a little bit reductive, I guess what I'm hoping is that it can kind of draw our attention to this basic principle that we should think about kind of where we focus. So not just the shiny innovation end, but the other end, the fitting of how it's going to fit into your service. I'm stressing this because while it might seem kind of self-evident, it's been very present in the conversations that we've had so far this morning. Actually, consistently in the health service, adoption is losing out to innovation. So nationally, there's still much more focus on pilots and funding for innovators. And yet, the kind of process of invention, it's really only, it's half the story. Innovations, they hold huge potential. Innovators really want to see the potential of their innovations to improve quality, improve efficiency. And yet, in order to realize that, rather than perhaps adding to workload or causing harm, they need to be properly implemented. And so this is where we should be bringing at least as much investment of kind of time, skills, resources, and creativity. So that's my first suggested simple rule. And I guess that complex, creative work of implementation, that needs a whole range of skills. So that's the focus for the second simple rule that I've got. So imagine now, I am quite a cheesy person, I have to say. So imagine now that your innovation has become a ball. Now, I have known myself to be completely immune to any interest or knowledge about football, given that I live in a household of football obsessives and yet know very little about it. However, what I do know is that it takes a set of people, you have a rough idea of getting a ball, and you need a set of people together to actually score a goal and get in there. In Scotland, they talk about the kind of multidisciplinary transformation team that is needed to take innovation and implement it successfully. If we think about any substantive change that we're looking to make in the health service, it needs the innovators, but it also needs people who can do a diagnosis of the current state, who understand change management and can implement it properly, likely to have people who will have operational, commissioning implications, and who will understand the kind of workforce redesign that's needed. I wonder how often we systematically think about gathering the people around an innovation in order to set it up for success. I guess in order to get an innovation in the net within 90 weeks, let alone 90 minutes, what is the chance of success that we have at the moment? I guess the example from my experience that comes to mind here is the introduction of video consultations. So I was really lucky to get to work with some early innovators in this field back in Newham in East London. I remember when working with a really inspirational diabetologist and her kind of nurse who decided that they wanted to try a kind of different model for delivering their outpatient appointments. And actually the number of things that needs to fall into place in order to get that work very slowly off the ground. So it required someone from the IT team who would give a bit of time to it, the administrators to kind of get involved. A very large part of technical expertise we relied on from the teenagers who were using the service, who helped the largely middle-aged clinical team work out how to get the tech to work. And it needed an operational manager who was so distracted doing other things that they didn't notice that they were doing this work without getting paid. So that work required a whole team of people, and they were doing it largely outside of their paid work. They were doing complex work over years, trying to work out and get a service to go from very first innovation to something that was working in one clinic, and then in a couple of clinics, and then across a couple of services. And actually, it was only at the point of COVID and the pandemic that actually, this all took off. And actually, this moved from being something for which we have to thank the people who are those kind of early pioneers in a few places for being able to then scale something pretty quickly. Because actually, one of the things that we picked up during COVID was that suddenly people were able to put aside kind of team and professional boundaries and bring together a team of people in order to implement something pretty quickly under pressure. This infographic is from the early stages of the pandemic when I was lucky enough to spend some time with 50 teams across the UK and Ireland who were implementing video consultations in different kind of service settings. And this just highlights some of the things that the group of people behind that work needed to pay attention to in order to get it off the ground in the yellow cogs. And then on the orange side, the things that they were telling us actually as we moved out of the use of video consultations when other service models weren't possible to being part of your kind of long-term service mix. There was a set of orange things here that actually were the complex further next stage of work to really embed and use it properly. Now, we made incredible strides, and this green cog at the end, the story it showed was people going above and beyond and working in ways that were quite different to normal in order to accelerate an innovation. But then as other services started to re-establish, actually we found the pace of change moving somewhat more slowly again. So I guess that's my second principle is, if we think that it takes a team of people to do this, how often do we actually free up the time for people to work effectively as a team and treat this as kind of serious work rather than stuff that's sort of done at the margins? My third simple rule is how we keep a focus on the kind of essence or core of what's actually needed for success through that kind of long journey to implementation. So our light bulb ideas. Thank you very much for whoever sourced the props for me. So my light bulb has changed from a football, it's now become an orange. Often we see a really enticing idea, something that's perhaps delivering a new model of primary care access or a new kind of intervention to support a particular cohort of people. Perhaps it's won an award, it's been, it's got some really impressive stats associated with it. But then again and again, we end up having disappointment and cynicism when it's tried in somewhere else, and lo and behold, it doesn't quite deliver the same results. Now, some of the researchers that the Health Foundation has supported and have looked into this describe it as a kind of cargo cult phenomenon. I won't get into that, but the way it applies to this analogy is that, in essence, people end up replicating the external appearance of the innovation, but they end up missing in the process some of the core components, which is actually what generates the juice. And that's why they end up having something that looks perhaps, or is named perhaps the same as the innovation that elsewhere has delivered results, but actually it isn't giving them the same benefits. Obviously, that not only is a loss for the services involved, it's partly where you get then the cynicism about the prospects of innovation. I mean, a second example of work from this part of the country, I think illustrates this well. An example of where work from around here has influenced the kind of international evidence base around this, as well as improving safety of care. So I think you'll be familiar with prompt and intervention based on work at the maternity unit in Southmead. The main kind of visible intervention that was developed was obstetric emergency training. It was something that was scaled with the help of Health Foundation funding and links to the HSN. So that was going really, really well in the first places that it was tried, but then actually they weren't getting the same results in other places as they started to scale elsewhere. And what the evaluation showed was that actually what proved to be important wasn't just the training intervention. You could do the training, but there were actually other really important parts of the socio kind of technical context within which the work was introduced that ended up being just as critical to success. So I think if we're going to think about what the essence of an innovation is, often we can think that the essence is the technical, is the tangible part of it. But as often as not, it's not, right? As often as not, it's about the culture, the leadership, some of the things that may feel a little bit more amorphous, but are absolutely critical if you want to get the benefits that you might expect if you do it well. So my next principle then is about actually how do we think about growing the innovation in the particular context, because if that context is really important, it deserves just as much kind of creativity and investment as the innovation itself. And it's really tempting, I guess, to think that there's a shortcut to adopting and scaling a particular innovation. I completely understand that. We are facing a lot of kind of urgent challenges out there. Aren't we all looking for things that we can pick up and apply quickly? You know, we're an impatient sector, and we want to be kind of getting on and doing things well. I wish the evidence supported that, but unfortunately, I'm afraid that approach is not delivering the results we want, that so many times we're doing things without the care and attention to creating the conditions, and then again and again and again we're getting disappointing results or no results at all. So that's partly because actually people will support what they create, and it's partly about actually you need to kind of cultivate the soil, the set of conditions that are required to make sure that you've got things lined up and that people have worked out exactly what's needed in order for, I nearly forgot my carefully sourced prompt, in order to make sure that something will actually make it to maturity. One of the first programs that I was involved in at the Health Foundation comes to mind often here. So there was some really interesting work done on flow that started in kind of Sheffield and Warwick. We were able to support them with a kind of multi-year program with, some really leading-edge kind of technical support, some investment in leadership and learning amongst the group. They went through this process of full diagnosis and capability building around what was needed to improve flow through the two hospitals. And then particularly in Sheffield, that led to some really interesting kind of bundle of interventions, of which one was discharge to assess. And that bundle of things built on this diagnosis led to some really significant reductions in length of stay in care of the elderly service, which led to some, major kind of quality gains and efficiency savings. Now, you can understand how, in a service which is looking for exactly that sort of thing, people latched onto this as a fabulous opportunity. But thinking about the team behind that work, they are always at pains to emphasize that the magic here and the focus isn't on the kind of intervention, discharge to assess. It should be at least as much on the process of diagnosis and capability building. That doesn't mean we have to start from scratch each time. Absolutely, we should be taking inspiration and learning from elsewhere. But actually, what we need to be doing is thinking about actually how do we create an environment where these ideas, we're going to be able to do justice to them. So, the Health Foundation has followed through on this by supporting the Flow Coaching Academy, so a way of supporting people to develop these skills using a kind of coaching experience, and experimented with the idea of social franchising so that the training intervention itself could be implemented in a way that had fidelity to the original intervention. And something at a relatively early stage, but that we're excited will kind of add to the evidence base in this area, is thinking about actually how do we create environments that are specifically designed and optimized for adopting innovation. So we're funding 4 innovation hubs across the UK. That program's relatively recently started. We've got one not too far from here. Really look forward to sharing the learning from that as it emerges. So I've introduced 4 of those simple rules. I'm hoping they might resonate for you if you're thinking about individual innovations. I just want to say a little bit more now about how we kind of innovate at the scale that we need to for the health service. I think there's a human as well as a strategic case for that. So I'm going to start with that human case, why it feels important to me. So that's Lucas, he's my son. This photo was taken just after he was born. So it was in St Thomas's Hospital in London in December 2010. It was actually snowing, just like it was yesterday. And he was born with a kind of minor infection and jaundice, which meant that we needed to spend the first week of his life in hospital. And when I wasn't kind of gazing at this thing, this newborn child that I'd brought into the world and trying to work out what that meant for my life, or trying and completely failing to get any sleep, because he was in a light box, I had quite a lot of time to look around and try and, I couldn't turn off that little bit of, I don't know if you find this, but that bit of you as an improver or innovator, that when you're in a health service, you can't help but spot some of the things that perhaps could be done differently. I've been, spent a fair bit of my time kind of in health services, and I suppose I could see, some good practice, but even in a kind of well-respected maternity service, a lot of things that, were not operating as well as I'd seen elsewhere. So, for example, the process for handover was clearly dysfunctional from one team to the next. And every time my son got his antibiotics, the process was different. I led the patient safety work at the Health Foundation for a few years. And through that, I got to meet people who were dedicating their lives to focusing on, a particular source of harm, often through a kind of personal tragedy. I'm really lucky that, story didn't end in tragedy. My son kind of went home after that week. He is now, he's now a kind of very active 12-year-old. So our course of our life didn't change that week as a result of that visit in hospital. But nonetheless, I find that my memory of that week keeps coming back to me. Not in relation to any specific source of harm, but in thinking about all of the different ways in which I think we could have done better. Because I think it was perhaps because I was suddenly responsible for a new being in the world. I was suddenly more alert to everything that could possibly go wrong. And it was at that point that I guess the real implications of our failure to learn and to innovate kind of came home to me in a different way. It's a bit of an impatience that still haunts me, because to be honest, it feels a very long time since this near-to-be teenager was born. We've been talking about spreading innovation for quite a long time, and yet I'm not that sure I'm seeing people getting substantively better at it. And I guess over the years, I've learned just how complex it can be. And yet at the same time, I've learned, just how important it is. And that's partly because, the work at the Health Foundation is an amazing place to work, but we're constantly looking across the board and we're seeing all sorts of things that could benefit widely still stuck in the place where they started. And so for me, kind of getting upstream, thinking about actually how do we innovate, not just in relation to one particular thing, but across the board, that's something that isn't a sort of abstract theoretical thing. Actually, it's something that really connects to what's important to us all, because unless we can get, really radically better at that, then, how are we to know that we're going to be able to be providing the care that we would want to receive at every point through the health service? My son may not have had an illness that stayed with him after that point, but I don't like to think about it, but he's constantly active. He's bound to need, he's used the health service many times since. He now has a younger sister. I don't like to think about it, but I know they're going to need healthcare through their lives. I'm quite fond of their father too. And when I come into people, through our day-to-day life, I think we want not just maternity services at one hospital to get better. We want to be doing it across the board. So that's a little bit why there's a kind of personal passion for me around this. And I'm sure we all have our personal reasons why the work we're doing is important. There's also a really strong strategic imperative. So, this is now kind of slightly dated, but it's just from a publication just showing the number and range of different organisations that are kind of strategically interlinked in delivering healthcare. And I don't think there's many parts of this system that couldn't do with some innovation that could really help and make our lives easier. To take one example that illustrates this, so the delays accessing care, it's that's a problem that is addressing, it's impacting all parts of the health and care system at the moment. And it's going to require a nature of innovation that isn't just about one or two kind of macro or specific innovations. We're going to need to be collaborating and innovating across a whole wide range of different areas. So, whether that's the way in which we redesign particular services, whether we think about the flow of people from one part of the service to another, whether we think about actually how we manage waiting lists, plenty of opportunities for innovation there. And of course, that you can innovate in the way in which we're working with patients and communities and staff to do that. The chart here is just one of, we have some colleagues in the Health Foundation whose job is to analyse performance in the health service. And they, to be fair to say, have a relatively depressing job. This is just one of a set of charts that illustrate a wider systemic challenge around the health service performance at the moment. In a way, we have a perfect storm I won't go on about at the moment of kind of workforce performance and underlying demographic kind of challenges. And I hope it won't be belittling to that to say that we're going to move into an exercise now, and it's going to be fun, and we're going to have a go at generating a kind of innovation snowstorm that will be equivalent to the performance storm that we have around us and perhaps the weather outside. And we're going to do that in a fun way, not because this isn't really important, serious work, but precisely because it is, and we're going to need the energy we'll generate between us in order to bring all we have to that. Tarnia.
I'm going to move your prop. I feel like we should have a raffle at the end of all of Penny's props. Orange? Anyone? I'm going to put this back. Okay. As Penny said, we're about to have a snowstorm, an ideas snowstorm. I know that's a really fast-paced exercise, and as Penny said, it's not to in any way undermine the challenges that we know we face in acting on our kind of innovations, but it does feel really important to really kind of practically demonstrate the energy that comes from and the importance of connecting on ideas. And what was really interesting is when I said you've got 1 minute more, I saw some panicked faces. And that's completely understandable because you didn't have much time, but we can really labour over ideas also and worry that they're not good enough. And it's important to illustrate that actually collectively we can really develop a seed of an idea. So on the screen, we thought we'd just kind of summarise some of the reasons that we like to use this exercise, and we'd really encourage you to borrow it, adapt it, take it back to your teams as a way of kind of illustrating the importance of coming together, and that kind of quick, fast-paced, kind of collective brainstorming and then building on that. Thanks, Penny.
Shall I move on?
Yes, please. Yeah, thank you. So this exercise is particularly fitting for us because I mentioned earlier on that I lead on our grant programmes across Q, and our flagship grant programme is called Q Exchange. And I don't know how many Q members we have in the room, but is anyone familiar with Q Exchange? If you could, yeah, great to see some hands up. Okay, great. So for those of you that aren't familiar, as I said, Q Exchange is our flagship grant programme. It's annual, and it offers our Q members up to £40,000 for their improvement ideas. And what's really special and actually still delights me about the programme is it really is collaborative. It was very carefully designed to enable as much collaboration as possible. And so for those of you that have maybe uploaded ideas, you'll know this process very well. But the way that it works for Q members is you have an idea, you upload it to our website, and it's visible to the Q community, who will then comment and hopefully help you develop that thinking ahead of it being converted into a final proposal. And then the kind of final collaborative stage is that we have the Q community vote for the 20 projects that we then go on to fund. And in between that, we have kind of panels of assessors that are very much made up of our community as well. And the feedback that we get every year is whatever is going on in the system, because we also ran this program, during kind of peak pandemic times, and we really understood the challenges that our colleagues were facing, is that people do feel reassured and re-energized by connecting on new ways of thinking or building on existing ways of thinking. And actually, Q Exchange it's in operation now. Today is the final day for ideas to be uploaded. I wondered if there's anyone in the room that has uploaded an idea to this year's Q Exchange. Great to see a hand there. Has anyone commented on ideas that they might have seen from others, I wonder? Okay. So we will be closing the ideas stage later on today. I had a look this morning, and we actually have over 120 ideas that people have taken the time to upload, and we're so pleased to see that. We're so pleased to see that kind of engagement. And building on from the exercise that we just did, we'd really encourage you, whether you're a member or not, to visit the Q page, visit our Q Exchange page, and look through those 120 ideas. Look for the ideas that are also from the west of England, but ideas that are from, across the UK and Ireland, because they might support you in your thinking within your areas of work. So there's a lot of inspiration to be taken from Q Exchange, and I love working on the programme. Can I have the next slide? Thanks, Penny. So, Penny spoke a little bit about the subject of reducing weights, and that was obviously what I asked you to note down ideas for. That is the theme for Q Exchange this year, and as I say already, we're seeing such a brilliant range of ideas, so please do go and have a look, because I think there's a lot to be taken from them. Thanks, Penny.
Q Exchange is kind of one of the grant funding programs that we offer. I'm going to talk now a little bit about some of the other ways in which we're supporting people to connect with purpose through Q. So again, we've had a few kind of hands up of key members. I'm going to keep this very brief. The best way to learn more about it is to chat to somebody who's part of the community. But as I say, a community of over 5,000 people involved in improving health and care. And we do a whole range of different things. So Q Exchange is at the slightly more structured end, but there are also consciously more flexible, organic ways in which people can connect through member-formed groups around particular topics, for example, or through our many events or visits. I think this is, again, it's a conscious set of different interventions, which, again, hopefully might inspire you to join if you haven't thought of that yet. But also, there may be some principles here that are useful for your wider work. Because actually, what you probably want, a bit like a city, you need some more structured roads, buildings, but then you also need different kinds of connections that play more to the serendipity and speed that we sometimes need and want. Tarnia, I'm going to hand it back to you.
Thanks, Penny. Another one of our grant programmes, it was a standalone programme that took place in 2021, was called Supporting Local Learning. And it was a grant programme that we offered just to the AHSN network, and we were really interested in funding work that kind of celebrated innovative exchanges of learning across networks. And one of the projects that we were very pleased to kind of co-fund was Black Maternity Matters. And Tasha mentioned them earlier on. Where is the Black Maternity Matters team? Because I think the project team is around. There's Nushin. I really encourage you to visit the team who have a stand just over here with some brilliant resources, because this is such an inspiring project. As was briefly touched on earlier on, it's a collaborative for maternity staff to come together, and it offers learning, QI coaching, peer support to improve inequitable outcomes for black mothers and their babies. And I think that this project is a perfect example of what it means to celebrate and honour differing expertise and really intentionally collaborate on making progress on a real-world issue. We're very pleased to be continuing to support the project. There are lots of things kind of bubbling away, but the team are working very hard at the moment to think about spread across the west of England, and we're very pleased to be continuing our work with them as well. I'm going to pass back to Penny to round off.
Great, we're nearly at the end there, but I just wanted to build on that slightly. So that's a really nice example of a kind of project-based phenomenon of how you need to connect different people as a really important part of the success of an innovation. And there's a kind of recent evaluation that has really brought home how that makes a significant difference if you're looking at an organizational level. I don't know if people are familiar with the Virginia Mason Initiative program and the evaluation that was recently published. It's attracting an awful lot of interest from a range of reasons. But this is one of the things that has really struck people, in a way making visible something that we've known for a long time but have struggled to evidence. So this is a social network analysis methodology. So the dots here are people. In this instance, people who participated in a kind of development program associated with it. And the lines between them show the connections that those people identified as being significant around their improvement work in some way. And what the evaluation that the Health Foundation was fortunately able to support has shown is that there seems to be a connection between the richness and sophistication of the social networks that exist within an organization and the ability to actually scale and perform well across the organization. So if you can see here, the trust on the left, rated inadequate, had a set of relatively limited connections between people. And those connections were also identified in the qualitative side of the evaluation as being more transactional. On this hand side, there seemed to be a palpable difference where people had consciously tried to create an environment where people were actually able to communicate regularly. They were able to discuss and share, and there was a structured process for doing that that had the kind of flexibility associated with social networks. And that appears to be associated with their outstanding performance, not only through the program, but as recognized by CQC. And I guess part of what makes us excited about the potential of Q, that from the start we've run with the academic health science networks as well as other partners, is that this gives us an opportunity to cultivate a similar phenomenon on a kind of larger scale. So this is from the initial evaluation of the very first 6 months of Q. So again, the people are dots, and the lines are connections that one or other of those people identified as significant and meaningful to their improvement work. So at the start of the design process, you can see a fair number of people knew each other a bit, a set of people over here who knew maybe nobody else, and these two people over here who knew only each other and nobody else. And then over the course of the 6-month program, we can see a much greater density of connections that has been formed. And actually, the qualitative findings demonstrate that that made a real difference. The evaluators were actually able to record a statistically significant increase in people's capability and confidence around improvement just during this period. And this was when we were designing Q. So there were no other interventions in place beyond getting a group of peers together in order to learn and from each other. So Q, now at 5,000 people, we are well beyond being able to do this analysis. It would be just far too clunky. But the work that we're doing on a smaller scale suggests that we're still seeing that kind of benefit. So that was where we kind of wanted to leave you, hopefully a little bit inspired to be part of Q if you're not yet. And if it's not for you to join as a member, there's many, many ways in which you can participate without joining the community. But that really spoke to that last particular principle there. And I hope that all of these simple rules, just as an offer, might help us kind of day to day to make the most of, well, evidently the brilliant innovations and ideas they're here in the room. Thank you.